The world is gradually moving toward vaccinating against COVID-19. But what about preventing the next pandemic? How important is cooperation between China and the United States in getting ready? Even during the Cold War, the U.S. and the Soviet Union cooperated in eradicating smallpox. The two countries may have had their differences, but they took a cooperative approach to disease prevention. I talked with Deborah Seligsohn, who teaches at Villanova University in Philadelphia, about how these two countries could come together on global health. Good to see you. I guess we do what? This? That's the right way there? I met Deborah in Philadelphia, near Villanova University, where she's an assistant professor of political science. Her research focuses on Chinese politics and U.S.-China relations.
There's a need to understand what's going on in a country, understand what the politics are, understand what the domestic interests are that are pulling leaders in one way or another. There's a mistaken belief in the United States that, oh, it's an autocracy, so the leader decides everything. And that's not true. It's a big country with many people in the Chinese Communist Party and quite a few in the Politburo, and you have large state enterprises, you have large provincial governors and other people who all have push and pull in different factions. And so it's complex, and you need to be paying attention to it because there is a politics there. I don't actually think politics is deeply rooted in culture. If it were, we would all still be under monarchies, right? Because we were 300 years ago. But politics is politics, and it's very complicated in every single country. And just trying to understand the politics of a single large city in the United States would be a lifetime's effort, right? So, yes, the fact that we lose track of what's going on in China at the higher levels. I mean, there are a ton of people working in the State Department and many other foreign affairs agencies within the U.S. working on it every day and know a lot that can be shared. But people at the top have only so much of an attention span, and the U.S. is trying to focus on the whole world, whereas most countries in the world view the United States as their top issue, and if not the top issue, it's definitely going to be within the top three. So the attention is often asymmetrical, I think. But I think what I would recommend is it's a difficult time with China, and there are a lot of serious issues, and those aren't going to go away.
Deborah has worked for several years in China. Her research focus is on public health, energy and environmental politics in both China and India. She believes global cooperation on public health issues like HIV, AIDS, and COVID is vital. A virus can be hanging around and being spread without our knowledge for a lengthy period of time, so we don't even really know when this started or how it started, right?
Right, and Michael Osterholm in his book, and he's like one of the foremost epidemiologists in the US, says we still don't really know if AIDS came from chimps or monkeys or other apes. So yeah, I think people have a bunch of theories about the specific origins, and yes, that came 35 years or so after the disease was identified. But also, yes, people think that there was this disease in West Africa that was called SLIM, that was people with HIV/AIDS, because the other thing I think people don't really understand is how exponential growth works, right? So one of the issues that happened in New York, it happened in Milan, it's happening in Florida, is that when the number of cases is low but rising, you can suddenly see this very rapid uptick. But the thing that people forget is there's often this slow growth before the curve starts to go this way. The slope of an exponential curve is kind of like that. And so this long period of slow growth if you're talking about a disease like AIDS, can be decades and decades, right? If you're talking about a disease like COVID, it can still be weeks or months. So we now know, for example, that COVID was in many places in the United States back in December, right? Before the Chinese had figured out what the disease was. It was already all over the world. And that isn't surprising because when you have a few cases, it looks like pneumonia. For mostly it's elderly people going to the hospital. Doctors don't start to be surprised until they see a lot more cases, right? So yes, probably started in Wuhan, but it could have been somewhere else where there were just a few cases. It's very hard to know.
But I want to get your thoughts about this theory that it's man-made.
I follow what the virologists say. I've read the peer-reviewed papers, and I think that's a more useful way to think about this. And the basic framework hasn't really changed since the big paper in Nature last March that's been cited now thousands, if not tens of thousands of times, that sort of says, yeah, there's some remote possibility of that, but that seems like the least likely origin story, and the most likely origin story is something having to do with animals and humans interacting through agriculture, most likely. So as far as I can tell, none of the actual sort of experts on this, the virologists, the evolutionary virologists, the people who look at this kind of stuff specifically, have seen new information that changes their mind. They all want more information to figure out the origins. But the bottom line is we often don't know the origins of diseases. That's actually quite common. We still don't really know where Ebola comes from. And whether we can treat it, whether we can prevent it, is not that related to whether we know the origin. The reason we really want to know the origin is in thinking about the next pandemic.
And while COVID-19 is still raging, researchers believe global cooperation is needed to prevent the next pandemic. But with scrutiny over COVID's origins, some experts say it's a distraction from the real work that needs to be done.
Of course, we're talking about the current pandemic, but the next pandemic is just around the corner. I mean, we know that. When it happens, we don't know, but we do know that there'll be another. Global cooperation is going to be key to that. These accusations can impede that. I know you worked in the State Department, you know about diplomacy, you know how words can kind of inflame things. What are your concerns about this?
Well, so I think the US and China absolutely have to work together, both to get this pandemic actually under control, right, to vaccinate the world, and to do the kind of monitoring that we actually need for the next pandemic. And what's particularly surprising about how badly we're doing cooperation right now is that we have this long history of doing it well. So the US and China collaborated to develop China's influenza surveillance capacity. So many epidemiologists still think that the most likely, really catastrophic pandemic, perhaps more catastrophic than COVID, is still likely to be an influenza pandemic. And with influenza, we worked with the Chinese to really help them set up nationwide surveillance where they collect samples every year and analyze them and send the data to the WHO. And a pretty large percentage of the information that the WHO uses each year to figure out what should be in the annual flu vaccine actually comes from this Chinese surveillance, because you have this enormous country with so many people, so many chickens, ducks, pigs, that it just is going to be where a lot of new influenzas arise. Not all of them. H1N1 arose in North America, but an awful lot of new variants. So that's kind of a history that we have where we really do work together well. And we need to be doing that for coronaviruses. We've had 3 new coronaviruses in the 21st century, SARS, MERS, and COVID. And there's no reason to think that's going to be the last of them. Many people say, oh, the worst one is going to be the one that kills the most people. But the truth is, when things have the fatality rate of a SARS or MERS, people very rapidly go into their houses and stay away from each other because they're so terrified. COVID actually hit this weird, for a virus, a sweet spot, not for us so sweet, where the fatality rate is still awful, but it's low enough that a lot of people keep saying, well, it won't happen to me. And of course, it transmits before you have any symptoms, the asymptomatic transmission, which was not true of SARS or MERS, and which is true of influenza. So we absolutely have to be working with the Chinese on better surveillance to prepare for the next one. We still don't have good antivirals to deal with coronaviruses. We don't yet have a universal influenza vaccine, which we need to prepare for an influenza pandemic. So there's a lot of work to be done, a lot of great scientists in both countries, and we really need them to be working together.
In 2002, a novel coronavirus was silently causing deadly pneumonia outbreaks, which later became known as SARS in China. It would infect more than 8,000 people globally and led to nearly 800 deaths.
Deborah, what I find unique about you, when you talk to people, they can tell you about COVID-19, but you lived through SARS in China and now COVID-19. Compare the two for me.
I do think the fact that the Chinese had lived through SARS, it's become very obvious. The Chinese, the South Koreans, the Vietnamese, the Thai, countries that had lived through an outbreak of SARS or MERS did much better in the early stages of the pandemic than countries who hadn't, right? That the citizens were prepared, they put on their masks, they started washing their hands frenetically, they were very accommodating of social distancing rules. They were prepared to have the kids sent home from school. All of this was not a surprise to them, and they responded very well. And I think experience was the huge difference. In the United States, I think we always assume that there's just going to be a medicine that's going to get us out of our problems. And to this day, people just assume if I get sick, there's some good cure. And even though the treatments are way, way better than they were a year and a half ago, they're not great. And no one should want to get COVID. And of course, we have a great vaccine, so people should be using it. I will say vaccine hesitancy is also something that exists in both countries. That isn't unique to the United States.
Both China and the U.S. have worked together on the global issue of climate change. In 2014, the U.S. announced it would share research, experience, and information jointly with China to contribute to the Paris Climate Change Agreement.
But you've seen firsthand cooperation between these two countries. It really kind of pushed things across the finish line in Paris when it comes to climate. And I know that's something you care passionately about. So you can see when these two countries work together, it can have a positive impact. So give me your experience from Paris, the takeaways, and how you might extrapolate that out given COVID.
Well, what's really interesting is Secretary Kerry has been very upfront saying, we're going to treat climate change separately because it's a global problem, and therefore we have to work with China regardless of these other issues in his role now as the special negotiator. And I've been disappointed that we simply haven't said the same thing for COVID and public health. It seems to me the issues are quite similar and that we clearly need a global solution. No one is safe till everybody is safe, right? And you can be someone who never travels around the world, and yet you are vulnerable to anyone traveling anywhere. So that hasn't happened, and that's been a disappointment. But what I would say is in the past, science cooperation has been one of the sort of cornerstones of the relationship. It began earlier almost than anything else, pretty much immediately after the original ping pong diplomacy of the early 70s, US government started sending scientific missions to China to look at what could be done together. And public health was very rapidly identified as an area where we could really work together. And that was in significant part because of this idea that we need to be working together everywhere to protect the world, but also because the Chinese actually had a lot of capacity to do things like collect data on outcomes from large groups of people. It's a big country with lots of people and lots of doctors to collect data. And so things like preventing birth defects, one of the most important studies ever done, was done in China way back in the 1980s. And huge heart disease studies, diabetes studies. We've been working with the Chinese on health issues pretty much continuously. I think one of the problems of the last few years has been that the US really has stopped recognizing the importance of that. There was a real sort of pullback of interest in this kind of thing during the Trump administration. There also was a lack of understanding that while the previous relationship had been very much a student-teacher relationship with the US coming in with all this expertise, all this equipment, Chinese now come to a US lab and say, wow, your equipment is older than ours. What is it you have to offer? And depending on the field and the subfield and the sub-subfield, maybe the learning has to go in the other direction, or maybe you're collaborating among peers. But we collaborate among peers all over the world, right? We collaborate with Europeans, with Japanese, with Koreans, with folks in South Africa or in Brazil or wherever. And what we need to do is establish a new kind of peer relationship. So I think one of the problems has been that in the United States, there was this view that China was just sort of this giant sponge learning stuff. And then that led to all this paranoia about intellectual property loss and all kinds of things like that. In the COVID case, it led to us offering to help them with things that we should have known they already knew how to do. You know, they needed this help during SARS, but it was 17 years later and things were different. So I think there's both an assumption that all China is doing is taking, which isn't true, and also this is total misunderstanding of where the forms of cooperation can actually be beneficial. And on the Chinese side, because the relationship was framed as this teacher-student relationship, now that they no longer are the students, I think people may not see what the advantages are of global cooperation, of what the interchange with colleagues actually would be, and some sense, especially on the government part, that maybe we can just turn inward and don't need to share information. But the incredible speed of scientific advance in the 20th and 21st centuries is because we do share globally, and scientists communicate in such a global scientific network. And so that would be a real shame. And I really do hope that the two countries can learn to reframe and rethink how the relationship has to be going forward. And what I can tell you is, talking to people doing health on the ground in China, they want the relationship to continue. They're still very open, the scientists, whether in the China CDC or in academic institutions. And I hope the Biden administration, starts to become aware of that and do some outreach, because there's real interest in China, and they know the problems that we still have, looking for the next pandemic, coming up with some antivirals that are much more effective for whatever new viral outbreak comes out. It's always going to take a little while to come up with a vaccine. You need to have treatments at the ready for people who get sick. And that's an area where the science still has a lot to do, and everyone in the world should be working together.
Terrific. Deborah, thanks so much.
You're welcome.